Once it starts, we're probably gonna have to get it. It's on Facebook Live. Posted, I think 3 or 4 times.
Well, the thing is, there is no open mic. It's going to be questions to the floor. So we really, because the challenge obviously is not really trying to go to questions only as opposed to remarks because it's got the challenge.
Are you guys all ready?
Thanks, Alan.
They can get up ahead of us.
My wife invited me away from that.
Grab a spot. Grab a spot here.
You're right, just go down. Okay, thank you.
What we're doing is
I can see her wanting to be a bit incognito. I'm going to get the minister and at the end.
Okay. Excellent. Thank you.
I found out this summer I can print things. Well, my son activated a code out of at the grocery store. And then he was sound on the outside for
Information, not direction.
hilarious. He's got to fight through the crowd at the door.
Yeah. Hopefully they can make it through.
My oldest just turned 17 and my youngest
Is it going to be questions from the floor or
Yeah. Questions from the floor.
so I can ask questions?
I just saw Nicole. We're in the nursing home.
Perfect.
9 o'clock. Can't go past 9.
Oh yeah, we're not going past 9.
Corinne, is it?
It's all right.
They're on the edge.
Yeah. Good evening, everyone. Can everybody hear me all right? In the back, we're good? No? Better now? Check 1, 2. Are we good in the back? Can you hear me? Blythe, yes? Louder, okay? Can we hear me now? I'll come closer. Is that better? Okay, good. Everybody, I want to welcome you here tonight. This is amazing. The turnout is beyond what we anticipated. Obviously, we don't have enough chairs. There's no doubt that the reaction of the community this evening is a clear message to those people on the stage, and to the government, to the community of Summerside, to Prince County, and to Prince Edward Island. My name is Derek Bond. I'm the Vice President of the Prince County Hospital Foundation. The foundation, thank you. The foundation, unfortunately, has had to take a much more role in advocacy in the past 2 to 3 years, as we've seen a steady decline in services. It is certainly our privilege to do so. And we want to thank you as donors and the community for supporting us as a foundation in taking on that role. It has been challenging, but yet we are here tonight to certainly make it clear to the members of the panel this evening and to government that we are here to advocate and support our hospital, and we want to see it grow and continue on for many years to come. I want to take a brief moment to thank the Mayor of Summerside and the City of Summerside staff who have really organized this event. My role this evening, yes, thank you. My role this evening will be as moderator. It's clear that given the size of the crowd this evening, we will need some structure, we will need some order, and I'll talk a bit about what the process is going to be. I just have a couple of words, and then the Mayor is going to say a few things. Again, I want to thank everybody for coming this evening. It's clear from the response tonight that the community is very concerned for the well-being of the PCH. It's unfortunate that it has come to this point. Our hope is that this evening is that the community receives a clear commitment, clarity, and accountability for this situation. It's evident that there's a level of frustration from the community, and it's clear that the required medical services have been reduced, and a further fear that they will be further reduced or perhaps not return, which is what we do not want to see. So the goal of this evening is to ensure that we have a commitment and a clear path that is communicated from the panel on how we can not only save and restore, but expand the services for our ever-growing community and the importance of the PCH. So I do want to thank our panel for attending. It's certainly not an enviable position to be in, but they are here. They're here to respond to our questions. They're also here to provide a presentation to the community. So we do welcome Minister Mark McLean. We welcome the interim CEO, Corinne Waswell, as well as the CMO, Dr. Catherine McNally, this evening. So thank you for coming. So how it will work is that there will be a presentation at the outset. The Mayor is going to say a few words prior to that. And then once the presentation is completed, we will open the floor to questions. We will be providing, and how it's going to work is, again, because of the size of the crowd, we'll try to limit the questions to a quadrant at a time. So I'll try and move around the room so that we can try and get everybody. We would request questions. We also request that the questions be limited to somewhere between 60 and 90 seconds. And we will allow an opportunity for a response. Obviously, the level of frustration is high. We want to make sure that the discourse and that the conversation this evening is one of respect. While we are frustrated, there's no question, we do want to keep that level of respect for the panel and for everyone in the room. So without further delay, again, we want to try and keep this till 9 o'clock at the absolute latest. I will turn the mic over to the Mayor, and we'll go from there. Thank you.
Thank you very much, Derek. I really appreciate you helping moderate here this evening. First, welcome to everybody from Tignish to Surrey. I originally had Tignish to Hunter River, but welcome, of course, to so many of our elected officials from across Prince Edward Island. Our MLAs, ministers, mayors, councillors, We have the chair of the Health PEI Board and the board members, a PCH Foundation chair and board members, and so many others. Welcome, of course, to our panelists, Interim CEO Corinne Roswell, Chief Medical Officer Dr. Kathy McNally, and Minister of Health Mark McLean, who I made a firm commitment to end by 9 p.m. So it is on me, so please try and help me out. I'm also not going to forget to thank our PCH staff, and I'm going to get to them in a moment. To follow up on Derek's point on decorum and respect, our panelists here are civil servants and an elected member of our community. They work every day trying to make people's lives better. They go home to families and will go home tonight to their spouses and to their kids just like the rest of us. So please treat everybody with respect and kindness. Applause is good. I obviously didn't need to say that. Heckling is not. Hard questions are good and fair. Personal attacks are not welcome in the city of Summerside. I also want to take a moment to welcome and acknowledge all the people who have worked and do work at the Prince County Hospital, and I see many of them here tonight. They are phenomenal. They have wonderful camaraderie and spirit. They care about everyone in this room, and they care about each other deeply. They are a group of team players, an amazing group of people who are often put in situations that are very untenable. So please join me again to welcome and start the evening by recognizing our past, future, and present physicians, nurses, RTs, physiotherapists, allied health professionals, the admin staff, the cafeteria workers, the maintenance staff, the security guards, and every other person who makes the Prince County Hospital tick. Let them know that we appreciate them and we have their back. We are here this evening because of withdrawal of critical care services from the Prince County Hospital. This decision has people scared, upset, and to be frank, steaming mad. 2 weeks ago, the East Prince Medical Staff Association unanimously endorsed that an emergency exists regarding critical care and acute care services at the Prince County Hospital. The next day, Local 942, who represents over 1,300 healthcare professionals in PEI, agreed with them. The next day, the PEI Nurses Union expressed their unequivocal support and agreement. Tonight, I hope we will find out if Health PEI and the government of PEI also agrees with them. The implications of this emergency and the failure to prevent it from getting to this point is clear. Further downgrades at the PCH, new barriers to retention and recruitment, and increased morbidity and mortality, or what our healthcare professionals call poor patient outcomes. These patients come from all across Western PEI and all across PEI. They are our friends, our children, our parents, our neighbors. They are also many of us. This really matters because critical care is critical to the hospital, and the hospital is critical to our communities. Without critical care, you lose quality care and capacity in obstetrics, surgery, pediatrics, inpatients, emerge. This also really matters because tonight is about more than just critical care services. This is about protecting all services at the Prince County Hospital. This emergency did not happen overnight. Critical care capacity has been eroding for the past 17 months at the PCH. In fact, 9 months ago, we had our first town hall right here in this room on this very topic. Our health professionals were telling us they needed support to get commitments to help stabilize these services and create an effective plan to reestablish and rebuild those services. We got those commitments that our health professionals needed, and yet we are here again. For 17 months, there has been a lack of planning, action, and accountability. It is the failure to plan and act, not the intentional acts, that is causing a loss of critical care and acute services at the PCH and the loss of the people who deliver them. And this is not just my opinion. Our doctors have said they are dismayed that despite acknowledging staff shortages, there have been very few tangible actions visible to them. There has been a failure to effectively plan and recruit physicians for retirements and known gaps in coverage. The allied health professionals have wrote saying we have been rebuffed at the idea that shortages were reaching critical levels. Our efforts are being met with wildly inconsistent messaging and a lack of accountability. The nurses union has said to stop wasting time in meetings to develop plans behind the scenes, only to roll them out with little or no time to engage in meaningful consultation. The language is heavy, and it is fair for you, for our residents, to get a response. How well tonight goes will be critical to us all moving forward together. We are all in this together, whether we like it or not, whether we want to be or not. The people here in this room have a voice that cannot be ignored. The people in our hallway have a voice that cannot be ignored. Tonight is critical because after getting all of this out in the open, and I think that's really good, I think that's a very good thing. For too long we have said we don't want to talk about these problems in public. It's going to push people away, and I don't believe that. I think that's going to bring our community further together, and people want to go places and live places and raise their family in places where community stands with each other. And that's obviously what we have here in Western PEI. Tonight is critical because to get all this out in the open, there is now a chance to get the changes that we need. And that makes me hopeful and optimistic, as difficult as that may be to feel right now. Tonight also gives the opportunity for leadership to exercise humility, but also to get inspired by our communities to set bold and transparent timelines, benchmarks, and pathways and deliver on them. So tonight I hope we will see a shift away from the reasons things can't be done to how they will be done. Tonight will go well if our residents know they are being meaningfully listened to. It will go well if our health professionals at the PCH and in Western PEI know that when they leave, things will be very different tomorrow. It will go very well when leadership supports the PCH and its people by believing in them and being physically present. And it will go well if there is meat on the bones. We will be listening for a commitment to a plan for stabilizing critical care at the PCH now and rebuilding critical care at the PCH in 6 months. We will be listening for a commitment to develop and execute a transparent plan grounded in community needs with PCH staff inputs and approval, with clear dates, benchmarks, and accountability. We will be listening for a commitment to go all in on retention and recruitment, to get the A-team on the ice, with a leadership team that includes people from the Prince County Hospital, with the money, support, and mandate they need to get it done. And perhaps most importantly, we will be listening for commitments on accountability. As each day passes in our communities, and whether that's Summerside, Skinner's Pond, Tignish, Wellington, O'Leary, Kensington, Kincora, and so on, you get the point. Without these essential services, the health and lives of islanders will be at risk, and that is a risk we are simply not prepared to accept. Thank you, and good luck.
Thank you very much, Mayor Dan. At this time, we would like to hand the microphone, if you will, over to Minister McLean for some remarks, and I understand following that that there'll be a presentation from Ms. Roswell and Ms. McNally. So the floor is yours. Thank you.
Thank you, Derek. Everybody hear me? Perfect. No? No, I know it's not very loud. Okay, I'll do my best. Okay. Good evening, everyone. I am pleased to be here this evening to listen and to have a productive conversation surrounding critical care at the Prince County Hospital. I also think it's an opportunity to talk about some of the actions that we've taken over the past few months and some of the intended results. It is so important that the Department of Health and Wellness and Health PEI communicate often and effectively to our workforce and to the public. I want to improve that going forward. Hopefully tonight you will learn about some of those actions and even the rationale and realities in making them. It will help, I hope it will help everyone to be more hopeful for the future as they understand the fear that people have. We know the challenges we are facing in our healthcare system are complex and are not unique to PEI. So let me begin by saying there is no plan to reduce services at the PCH. We are hearing words like cuts, it's part of the plan, etc. So I've only been in this role since last May, and I can tell every one of you here tonight that those words or phrases have never been spoken in any meeting that I have ever participated in. To suggest this, I understand it polarizes people, it scares people, and I think it can even agree, it may even disrupt everyone from our focus. We want to focus on solutions. There is simply no possible path forward to deliver healthcare on PEI without a strong and vibrant PCH. We need every part of our healthcare system. Our ability to serve a population approaching 200,000 demands that it be so. And yes, I will admit that it does bother me a bit when we hear people say, we want to close this, we want to close that, we want to move that. Tonight's meeting is about a human resource challenge. It is not budget, it is not political will or any other reason. I can't emphasize that enough. The strength of the city of Summerside and the surrounding areas is incredible. It has always been this way, and it will always be that way. We all need to work together to build up the PCH. If we have the resources to run a service safely and effectively, we will do it at every single opportunity. This isn't a political statement. This is a statement of our humanity as islanders and also on behalf of our healthcare givers. We want to take care of each other as best we can and as safely as we can. In terms of our approach to continue to invest at the PCH, I want to let everyone know that we were able to hire 4 physicians in 2023 to work at the PCH to provide more services to all residents accessing the hospital. They include 1 ER physician, 1 OB/GYN, 1 surgeon, and 1 pediatrician. Those physicians provide extremely valuable services to support the hospital. We are also actively recruiting more physicians to support critical care. Again, I think it's important to understand our financial commitment to the PCH. The budget for the PCH in 2021 was about $190 million. This year it will be north of $219 million. So again, back to we are investing both financial and resources into this hospital, and we will continue to do so. Appropriate staffing is vital in all healthcare facilities. for both the safety of our patients and the well-being of our workforce. To many of us, a doctor is a doctor, but obviously that is not the case. They require special education and special training to perform various services for Islanders. We have been asking a lot from our healthcare team here at PCH, and they have been absolutely incredible. But we are burning people out. Some are basically just working and sleeping. One of those was actually the flower girl at my wedding. That's not right. That's not safe. I hope we can all agree on that. That's not a realistic expectation, but so many of them have been doing this for months. As we know, unexpected disruptions in physician, nursing, and respiratory therapist coverage has forced us to change how the progressive care unit operates at PCH. If we had the appropriate staff available to fill the roles, we wouldn't be making these temporary changes. It is an operational reality and not a choice. This change is made to ensure patient safety and to ensure the physical well-being and mental well-being of our healthcare workforce. We are working to restore critical care services at PCH. I know everyone here wants a timeline for our plans to restore as many services as possible, but it is wholly dependent on having the human healthcare resources that we require. We are committed to a stable and reliable service that is well supported and that does not put strain, even more strain, on our healthcare workers, especially those who are already stretched so thin. With new direct pathways for physicians to get licensed on PEI from international jurisdictions, we have broadened our ability to recruit physicians here. This happened on November 2nd of this year, so it is a new day for pathways to practice medicine on Prince Edward Island. We are just starting to see the benefits, but with this, we have opened doors that were previously closed. I want to again thank the College of Physicians and Surgeons of PEI who worked with us to make these monumental changes in November that will help recruitment of physicians and Canadian medical school graduates who are studying abroad from jurisdictions like the US, Ireland, UK, and Australia. It is monumental change. We do already have international recruits in our pipeline. We need more respiratory therapists, an integral part in delivering health care, especially in critical care units like the progressive care unit at the PCH. Unfortunately, we do not train RTs on PEI. We have 4 RT positions posted for the PCH and have dedicated recruitment staff sourcing leads domestically, internationally, and through training institutions across the country. We will be attending the Canadian Society of Respiratory Therapists conference in May in Alberta. We have recently made changes to the pay scale for these critical positions. The wage we will now pay to RTs is among the highest in the country. I also do know that our recruitment team will be visiting New Brunswick Community College in the coming weeks to meet with RTs that are graduating from that program. We know that every department and every hospital would say that they need more nurses. We've expanded the number of nursing seats at UPEI from 72 to 98. This is as much as the space allows. We've created more training opportunities for LPNs at Holland College, but there's more to be done. Our plan is to hire as many as 200 internationally educated nurses to support our workforce. We have had successful recruitment missions to Singapore and Dubai, and our team is actually overseas now in Dubai, and we had more than 1,000 applicants, and they've screened that down to 140. So today, tomorrow, and the next day, they will be interviewing those 140 international nurses. Soon we will have our first groups of IENs, as we call them, to PEI and begin to be integrated into the system. We have 22 arriving at the end of February, and they will begin what we call the bridging process to integrate into our system as RNs. For physician hiring, we are removing unnecessary hiring bureaucracy like the Physician Resource Planning Committee, which causes unnecessary delays in doctors. Huge. All these measures are starting to help hire healthcare professionals more quickly and allow us to access talent from Canada and around the world. I know it's not fast enough, but these pathways are new, and they are such significant improvements to increasing our possible pool of recruits. The temporary challenge we're facing at PCH is related to needing more healthcare workers, and that is our focus. Our plan is to stabilize the PCH and restore critical care services as soon as possible. We are so fortunate to have the dedicated, passionate healthcare workers that we do, but we cannot continue to ask them to stretch any further. Everyone is working hard here to do everything they can to get more health workers hired in our system, including the vacancies at the PCH. It's my hope tonight that you recognize that we are not doing the same things and expecting different results. But the mountain that we are climbing is high. We're doing everything we can, as fast as we can, to make meaningful change to improve the healthcare system, and I understand it is not going fast enough. I share your frustration, but we have made some very positive steps forward that will help us in a sustainable way so that the pendulum does not swing again so hard in the years to come. I look forward to hearing your questions and giving you straightforward and candid answers. Thank you very much.
Thank you, Minister McLean. Before we move to the next speakers, I just want to mention, too, that while this room is very, very full, we also have an online presence of approximately 1,500 people watching on Facebook, so thank you for joining us online. Again, a strong testament to the concern and the engagement of the community. So I'll pass it over now to Corinne. Thank you.
Thank you. Okay, I'm really going to have to use my outside voice. Can you hear me okay? In the back? Not at all? Not at all? Is that better? Okay. Thanks, everybody, for being here. The numbers that I'm seeing in the crowd and the numbers that are in the hallway that have not been able to get in are really a testament of the importance of this issue. I can't tell you enough. My family is from this area. My parents have been in your hospital at PCH, and they receive home care services. They've been at public health. We know that the importance of the healthcare system, and I just wanted to share that because it's very real. I'm asked for a plan almost every single day by my family in terms of what it is we are doing, and I really want to thank Minister McLean for sharing some of the fundamental pillars, I guess, of what it is that need to change in order for us to recruit and retain better. I think it's some of the barriers that have been in place before have been monumentally moved. I did want to say, while we're here tonight to talk about Prince County Hospital and the fact that so many of you are here are from across the province, Health PEI is responsible for the delivery of healthcare services across the province and in all facilities and programs. So we think about the numbers that we have in home care. On any given day, we have 2,600 active caseload in home care across the province, 80% of which are over the age of 65. That service helps ensure that there's flow and patients moving through the hospital, and that the hospital is there when they need them, but not that people don't have to stay in the hospital. 1,000 of those are from the Prince County generally. We know we have vacancies across our system, and they're across all the disciplines. So we know we have vacancies in physicians, we have them in nursing, we have them in RTs, in allied health. The growth of our population, together with our aging population and our changing workforce, have created very difficult pressures. Health PEI and the Recruitment and Retention Division of the Department of Health and Wellness, as well as the Public Service Commission, are partners in attracting and hiring more healthcare workers in Prince Edward Island and across the province. Minister McLean spoke about the IEN missions to Dubai and to Singapore, and there's another one happening in Dubai this next 2 weeks. There are staff from Health PEI at those missions, the Public Service Commission, and Recruitment and Retention. And that partnership has been really amazing in terms of both the hiring process or the offer process, but also in bringing people back. The intention, we're working with the Department of Settlement as well to ensure that people, when they're here, are settled into their communities and supported. So we're committed to working together with communities and our staff and our physicians to make sure that we can grow the services in Prince Edward Island. As much as we recruit, we also need to do everything we can to retain our staff. We know that a positive patient experience is having staff who are well and able to practice to the best of their scope, the max of their scope, and to feel good about the day that they put in every single day. And we know that they've been stretched. So we find ourselves here today, and I appreciate what we were saying about this being a building pressure for the last 17 months. We find ourselves here today having to ensure that we release that pressure a little bit. We have no intention of making this a permanent situation. These pressures are being felt in this community and others in PEI, and we know that people are fearful. We will do everything we can to ensure that that fear is mitigated and that we're able to provide as much service as we can where we can. I will be sharing a few highlights of how we're addressing the issues and working with PCH to grow the services at PCH with you tonight. As Minister said, these solutions won't necessarily be quick or achieved quickly, but our goal is to work together with all partners to remove those barriers. We've heard from many groups who want to be part of this solution: the city, the foundation, our staff, and our physicians, and those of you who are here tonight. We'll only be able to achieve the success with a bright future we all want for our healthcare system. That's why I come to work every day. Thank you. Just go ahead.
Sure, you can go ahead. Yeah, I understand there's a presentation. That will be.
Okay. This is going to be, we want to get to the questions, so I'm not going to spend a lot of time on this. So as we said, we believe that Prince County Hospital is a cornerstone in care for Islanders. It is the main emergency center, or full service emergency center, 24/7 for Prince County and PEI, and the only site with dedicated critical care beds. The support and success of PCH is necessary for all of our healthcare system, for all Islanders. One of the questions that we had forwarded to us was that we had that there was a plan to be a reduction in our emergency services. Patients with urgent and emergency critical care needs will be seen in the PCH emergency department when they need care. There's no intention of reducing services there. The emergency department has always received and cared for these patients, who are then transferred to a critical care hospital bed or to specialty services or to off-island services as necessary. We work with Island EMS and our emergency teams to coordinate safe transfers to patients with the right care professionals. In terms of what we refer to as critical care, it's care provided to the most severely ill people in the hospital system. On PEI, it's offered in emergency departments, progressive care units, and intensive care units. Critical care relies on highly skilled and trained staff, nurses, and physicians, and the staffing needs are intense. I want to share a little bit about the highlights of our planning to date. My first key point is that the planning is dynamic and it will change. Our first phase is really focused on stabilization. All parts of Health PEI are working closely together to advance the best pathways to stabilizing and rebuilding care at PCH. As the Minister said, this is everybody's clear intention to address the current issues and then build upon services. As we do this, we will work with community partners, physician groups like the East Prince Medical Staff Association, local retired physicians, and foundation leaders, among many others, to ensure PCH is resourced to meet the needs. We have had to change the level of care offered in critical care unit for now to relieve the pressure on the system as we build back the staffing. The short-term state will have 4 PCU level beds that can be managed at PCH safely. An additional our intention is for an additional 4 beds that will be available for people who are have to be repatriated from either out of province from the QEH. We need to ensure that bed capacity and bed flow is moving. This stage has required us to send more severely ill patients to either QEH, where staff have been working hard to receive the patients and provide the needed level of care. As always, some patients will need to continue to go out of province. Oh, sorry. The second phase is our building back phase. This phase will lead to the reestablishment of 8 critical care beds at PCH. In order to do this in a way that won't lead to more staff turnover, we need to attract a significant number of healthcare workers. We need at least 5 internal medicine physicians. Our current complement is at 2. We need at least 15 to 16 critical care nurses, and we have approximately half of that number at the moment. Our priority is to strongly recruit for these positions and make sure these roles are as attractive as possible to the candidates. And at the same time, we need to support our existing staff. Sorry. And then phase 3 is about working with our partners, internal to the health system and in the community across PEI, to develop a longer-term vision and action plan to redevelop PCH. So it's resourced and positioned to meet the needs now and in the future. This stage will entail a thorough review of the demographics, our patient population, our growth in our population, and what those needs are anticipated to be, and then building it up to in the hospital to meet those needs. This work has already started as part of our master planning with hospitals at the QEH and in East Prince, Kings. We are initiating the proposal that is going to be going out to initiate this for PCH and hospitals west within the next week or so. At that point, the work will involve consultations with internal staff and physicians, and then also community consultation. Staff resource planning will be integral to this. So this is a a planning phase that has been happening over the last little while. We know that our hospital system is integrated and needs to flow from facility to facility, and it also involves our community partners to ensure, our community programs to ensure that that patient flow continues as well. We know that the resources that we need to do the stabilization, we will need to involve travel agencies and locums to provide that support. And we do know that in the next 3 weeks, we will be having more travel agency nurses coming to help support. But as we build back, having that clear clinical resource plan, which some of that work has already been done, so that we know what resources we need in the future and know where we can get them. Thank you.
Thank you, Corinne. Was there anything else for the presentation, or is that concludes it? Okay, thank you. So, folks, at this time, we would like to open the floor. There is going to be a method here to this, given the size of the crowd. I do want to remind people that, again, on the respect and the decorum piece, we will limit the questions to approximately 60 seconds per question. If you're not quite sure who to direct the question at, please just direct it to the panel. And we will have mics going out here shortly, and we'll facilitate that. Another piece I did want to mention, and the mayor touched on it briefly, the goal here is for the community to speak. We recognize and we thank the MLAs for coming. However, we do want to keep this as a very community-based opportunity for you as members to address the panel. So we'd be asking that community members only and certain municipalities be able to address the panel. With respect to, again, the timing, I'll be interrupting if we feel that perhaps the question's not quite there, or if we're kind of steering off, because, again, given the size of the crowd and everyone's time restraints and commitments, we want to make sure that we keep this going in an orderly fashion. So, again, we're going to break this up into quadrants. So I'd ask, if this section here in the first 10 to 15 rows, are there any questions in this area here? Yes, ma'am. Okay, if I can have the mic.
Hello, my name is Kendra Gunn. I'm a long-standing resident of Summerside. Raised my family here, and my parents live here. They're with me tonight. I have had the benefit of working on behalf of healthcare providers and for the health system for most of my adult life. I know that the fragile state of our provincial health system is not unique to PEI, and that the challenges faced at PCH are not because capable and invested people aren't trying very hard to keep the system functioning. I'm going to try to keep this really short. Having said that, it's terrifying to know that there's currently only one functioning ICU to serve 175,000 people in our province. The QEH has 243 beds and 14 internists. PCH has 110 beds and a little less than 50% of QEH's capacity, and we currently have no internists. If the province really believes there should be one island health system, relying on the QEH to provide all ICU services is not safe for islanders residing in the catchment service area of PCH. If the goal is to have a functioning ICU at PCH, I've heard you say PCU, but I really think it should be ICU. And we've heard from Health PEI leadership that it should be. Why is there not greater collaboration between the two acute care facilities to ensure maintenance of that service, even on an interim basis, until staffing stabilizes? Why aren't doctors and nurses traveling to PCH instead of patients being transported to QEH? And I really want to highlight the doctors because I know firsthand that RNs can be reassigned when the need exists. Thank you.
Thank you, Kendra. That's an excellent question. It was one of my written ones. You've already hit the nail on the head. So the question is, why is it that there are so many ICU doctors at the QEH and there's so few at the PCH that we cannot work collaboratively to bring those to PCH to stabilize things?
Dr. McNally is going to take the physician question.
I'll start. Thanks, Kendra. Good to see you. Oh, how about now?
That's better.
Better? Thanks. So Kendra's question has 20 things we could talk about the rest of the time in it that I think are really important to address. So there's a lot of nuance in terms of medicine and who does what and what your ability is. So the group at QEH, and I think there's 14, Kendra, I couldn't tell you exactly. It's a big group of a bunch of small groups. So the QEH group, they don't all do ICU or critical care call. About half them, or a little bit more than half them, do the critical care call. There's one rheumatologist on PEI, he's part of that group. 2 cardiologists, 2 respirologists, 2 gastroenterologists, and those are provincial resources, and they do critical care on top of the work they do. But they don't all do the critical care call is part of it. Not all, and there are internists at PCH. We have 2 internists at PCH and a number of locums. The QEH physicians did come to Summerside and provide internal medicine call in person for 8 or 9 months. They have 2 call schedules down there. They have general internal medicine, and then they have the critical care call, and they came up and did a 3rd as well. And just like our docs in Summerside, they were exhausted. So just like our physicians here in Summerside are working really hard, the docs in QEH are working really hard too. I think it's really important to talk about call as well, because I don't know, I did not understand what call was until I was in medicine. I was in medical school when I figured out what that was all about. And so what happens with call is the docs work every day, Monday to Friday, their normal jobs. And they see, even the internists, they're seeing outpatients, they're seeing people with chest pain, they're doing diabetes work, congestive heart failure, all that kind of stuff. Then in the evenings, they are working all night, and they get up the next day, and they work again. And then they cover the weekends, because critical care is 24 hours a day. It never goes away. You have to be available. And so it's like having 2 separate jobs. You know, they're working all day, they're working at night, and if there's only 5, that means every 5th weekend they're away from their family working all weekend, and they come back on Monday to start it all over again, but they didn't get a break. And every 5th night they're awake all night working. And so I think our healthcare system has worked really well on the backs of the healthcare providers who are doing it, and they're tired. We have more patients per capita for physicians in this province than most parts of Canada. Our specialists, our medical specialists, our surgical specialists, and our family physicians. And recruiting physicians historically has been very, very difficult in this province, and there have been a lot of steps taken recently to try to alleviate some of that. So I think, again, like I could talk about Kendra's question all night, and I'm happy to talk about Kendra's question all night, but I think it's complicated, and we've asked a lot of all of our healthcare professionals, we've asked a lot of our physicians, and we need more of them in order to keep this afloat. And we have to get more who do that work. The intensive care training, the critical care training, everyone does not have that ability. It takes special people to step up and want to do that, which many of your physicians here have done to support that work, and they're tired. So we can't burn them out because that's not retention. So it is recruitment and retention both.
Thank you, Dr. McNally. Are there any further questions? Oh, sorry. Any further questions from this area? Yes, sir. Go ahead.
Hi there, my name's Alan Thorpe. I've been a resident of Summerside for 35, 40 years. It's no surprise to anybody that baby boomers are getting older. Hey, it happens. Yep. I'm one of them. That they retire, including healthcare workers. It's also no surprise that they require attention. They require more medical attention, as they get older. These things are known and have been known for a long, long time. My question is, and whoever wants to answer it, no problem, why did we have to hit absolute rock bottom before the government did anything?
Thank you, sir. Thank you, sir. Excellent question. I'll put that to the panel.
So I want to talk about doctors again for a second. Sorry. And there's a lot of healthcare workers. It's not all about doctors. Everybody's important. But I just want to say, I'm going to date myself. But in the 90s, in the mid-90s, when I started medical school, the government at the time decided to cut funding to medical seats across the country. And there's a big downstream effect of that. If you're going to be a family doc, the shortest period of time you can do that in is 10 years. You can't do it faster than that, full stop. And specialists can take even longer, the other specialists. Family physicians are specialists. So there's a big downstream effect. Then back, I'm going to guess it was maybe 10 years ago, there were consultants brought into PEI to do reports. I was not in leadership at that time that I can recall. Maybe I was. And they came in and they did reports. And in those reports, they said that we should start cutting the number of physicians on PEI. Yeah. And all of the physicians at the time said, this is kind of crazy. Why would we do that? The boomers, sir, just like you're saying, are there. And they're not getting healthier. They're not getting younger like all of us. And medicine has advanced so much that people live longer because we know more and people are more complex. So it took a long time for us to get where we are. And there were a lot of decisions made that ended in a health human resource crisis that we're in. And it started a long time ago. And if you had asked me 10 years ago, are we going to have enough healthcare workers in 10 years? I would have said no. Because of those decisions. And it takes a long time to fix those staffing crises. There are some short-term things for sure, and the minister talked about a lot of them tonight. But there's also, we have to think about those things. When I started in this position 3 years ago, the first thing we did was say, show me what's been happening in terms of staffing. And they were able to show us a steady decline in the number of healthcare workers over the previous decade. And then we had a pandemic. So I think that we can think about the short term, but we have to also think about how we got here in the long term.
I would like to jump in on that too. Thank you, Dr. McNally. Again, coming into this job, I consider myself a bit of a reader, so to speak, and I do remember sitting in the office and reading about physician supply in Canada. For example, in 2021, there was 2,400 family doc positions posted in Canada. That year, we had 1,200 graduates in our system. So it is a damn shame that we've come to this point, absolutely. And again, I think I'll talk again, that's why I'm so hopeful with some of the changes with international recruitment. And I want to explain another thing tonight is we have about 1,900 Canadians at international medical schools because they can't access medical education in Canada. That's another longer conversation. But previously, for example, if you were in Ireland at medical school, you would have to compete for a residency position in Canada. So of those 1,900, about less than 400 were successful in getting residency spots. So the other remaining ones would choose other countries, for example, the US. So really, they were gone from our system forever. That is no longer the case. So I'm very hopeful that that has changed. Again, I don't want, it's not all international. These are Canadian medical graduates that now can perhaps easily practice in Canada, especially in maybe the twilight of their career. Their kids are gone. Prince Edward Island would be a wonderful place to return home, to come to Canada to do that. So I can't emphasize that move in November and the total impacts, not only on international recruitment, but our own physician supply that are already out there, which could never happen before. And again, to give an example, you could be a Canadian, go to Harvard Medical School, do your residency at the Mayo Clinic. Prior to November 2nd, there was a lot of barriers for you to come practice in Canada. So that has changed. So again, monumental shifts. It sounds like a blaming statement. Again, why couldn't you see this coming? But again, that's what we're faced with as a society, and it's challenging. There's no doubt. So I want to kind of talk a little bit about physician recruitment and so on and so forth. In 2023, we were able to hire 24 physicians on PEI. In the past, we used to kind of announce them with some fanfare and so on, but we want to respect privacy. But I think going forward, I think we need to make maybe announcements quarterly, maybe just the position and maybe where the county that they're going to practice, so that the public understands that we are going in the right direction. So the next question is, how many physicians did we lose in 2023? So the answer is 15. Yeah, but and lose is a term. There's 5 retirements. There's 2 physicians that have stopped practicing for a lot of reasons. There's another physician that went home to take care of aging parents. He said to me, I almost want to write a letter to the editor and say, I love it here, but I have to go home and take care of my wife's aging parents. We lost one from academic reasons. So, we're down to 5, 6 or so that we might have lost in our system. And that will always happen in any business, that people may not be satisfied with it. So I call it the net stat. So what I say is 24 less 15 is plus 9. In 2022, we hired 28 physicians. We had 24 retirements or moves. In 2021, we hired 31 physicians, 21 left. It's a positive net stat of 10. I'll go one more year. 2020, we hired 21 physicians and we had 17 retire for a net stat of 4. So it would kind of go against the numbers. Well, why aren't we keeping up? Again, it's a broken record. Population growth, another 30,000 people in the last 7 or 8 years to Prince Edward Island. Complexity of cases, smaller practices, that's going. So I know the narrative is that we don't do well. I think we punch above our weight to attract physicians to PEI. And again, we're just talking about physicians, and I don't want to discount the value of our nurse practitioners and other allied professionals that do that. But again, back to the residency matching and the international pathways, that gives me hope. I hope it gives people hope here today. And again, if without that, we are in an extremely competitive market. In order to do that, so I'm hopeful for the future. I'm hopeful for the PCH, and I'm hopeful for PEI in general, that we can recruit, retain, and train to improve services. Thank you.
Thank you. Thank you, Minister McLean and Dr. McNally, for those remarks. I'll reiterate, perhaps to the panel, I've given a timeline of 60 seconds to the questions, so I may flip that around on you guys and make sure that, because we have a lot of questions, we want to make sure the responses are quick and to the point. So I'll start to cut you off. All right, go ahead.
Hello. Consolidation of local hospital boards to a Charlottetown Center model started 25 years ago. We opposed it in Surrey because we said the local interest wouldn't be cared for without a local board. 13 years ago, as chairman of the island-wide hospital access, we opposed centralization of services out of Summerside into Charlottetown, worked with Derek Key and Wayne Crew, those guys, and we opposed rural closures of hospitals that was proposed by the government at that time. We marched, protested successfully, and the small hospitals stayed open, except for Tyne Valley. At that time, problems were seen, but leadership had no appetite to hear them. In fact, Dr. McMillan speaking about them tonight, that's the first time in 25 years I've heard somebody acknowledge the type of issues that we were speaking about. They were forecastable problems. You could see them. But with centralization, healthcare stopped being a community issue and it became a political issue. Centralization has led to higher costs and lower services. We have 30,000 people in PEI with no doctor. I can hardly believe I'm saying that. We have 5 million people in Canada without a primary physician. It's falling apart. We have the worst access in Canada in PEI. Came out in the news last week. That's not my opinion. That's factual study. And the other fact is we consistently rank second worst in the 11 developed OECD country studies for access. So clearly centralization of local boards has not worked. We're continually told, even today, and even recently I heard it on the news that
we need a question.
The question's coming. We're told we have the best health care in the world, which is clearly not true. So I want to ask the room, who has confidence that the current structure of Health PEI will deliver the type of health care you want and deserve within the next 3 years? Show of hands. Who believes health care, the current structure will deliver it to you? My second question is, by show of hands, who would like to see a return to local boards with local administrators looking after the local interests, pushing the province to look after your own community's health care?
Thank you. There we go. Thank you, Al. There was no real direction to the panel there, but thank you for your input. Okay, we're going to move around the room down a bit. So past, yeah, we've got a gentleman there in the back with a hat. Or, no, sorry.
I was promised I'd be next.
Sure, sorry. No, thanks.
I just want to address the panel. Thank you for being here. But you have given me no hope. And the reason for that, I have not heard you actually address anything that is tangible and actionable to make me believe that things will improve. Now, where I'm finding the concerns, there is no accountability for our health agency. There has been no real discussion about correcting the outflow problem, which causes the ED crowding. When you talk about beds in the PCU, a bed is a bed, but when it's in a medical setting, there has to be the staff appropriate for that. I haven't heard you include that. You said there were 4 physicians that have been hired, but only one was an ED department. I haven't heard that you're bringing in the staff. It's just basically that the staff that are already there are going to have to further stretch themselves. It sounds good on paper, but you haven't given me any sense of hope or that we're going to see all of these things that you're trying to promote, that it's a good thing, that it will benefit PCH, that we're not going to have a reduction in what's being available to the people of Prince Edward Island. But, sorry. Yeah, question, thank you. Okay, where is the accountability for, please excuse me, accountability with the health agency? We need to see accountability with the health agency. So what you are saying, there is no accountability to ensure that will happen. Second of all, we need a plan in place for the outflow. We have a lot of medically discharged patients that are holding up beds that deserve to have care, should not feel bad for doing that. We've had people that have been there for 2 years holding a bed that are medically discharged. We need a tangible, actionable plan in place for those people. They deserve it. And I guess that's my time. I apologize, I rambled. Thank you.
No, I think there is a question in there.
Yeah. So I can take certainly the question around the outflow of the hospital and the overcrowding in the emergency department and whatnot. And I think that is fundamentally the work that we are doing to build services in the community. And that includes the primary care roadmap, which we've launched 17 patient medical homes that will be with physicians, nurse practitioners, other allied health, and based on the patient population. We've launched 17 of those so far, and we're on track to launch up to 27, or up to 30. In addition, the resources that have been added to seniors care. So I've already talked about home care and the supports that are provided there. Our long-term care length of stay has traditionally been very long. And without building those resources in the community to support patients in their home, they have been entering long-term care earlier. And so what we're doing is really working hard to build those services in the community so that the beds are available for the people who need the beds. And once they're medically discharged, they're able to go. That has been part of our annual report, so the accountability is there, the funding has been there, and our challenge is to hire enough resources without destabilizing our bed-based care, which is also critically important.
Can I
30
tackle
seconds?
the
Sure.
hope?
Again, the question was really coming down to accountability. So do we have a commitment from both Health PEI and the government that there's going to be no further reduction in services and that we'll move towards a full complement and expansion in the future? To me, I think that's the question.
Thank you, Derek. And again, back to my original comments, we need every service that we need. There hasn't been a lot of decision making in this process, unfortunately. It is an operational reality of what we've had to do. Again, back to cooperation, very pleased to see we have 4 board members from Health PEI here today. We have probably 10 or 12 MLAs. I can assure the residents of Summerside that Minister Ramsey, MLA Hilton McClellan and Jill Arsenault and Tyler DeRoche are your biggest advocates. They are fiercer than anything that will come out tonight about our services. So again, I think that's what in my remarks I want to explain, that there is no decision to cut services. And I love the outflow question. That bothers me too as well. So I know in Summerside specifically, Andrews of Summerside have another 10 beds.
Minister McLean, I think we're going to cut it there.
Yep.
Again.
Well, they don't want to learn.
We want the affirmative answer that the government is going to provide commitment. I didn't hear a yes in there. I think you said it at the beginning. My concern is that Health PEI said we may have every intention. Obviously, there's a difference between a commitment and an intention. So the question was on accountability. Is the government and Health PEI committed to maintaining and expanding services at the PCH?
So Health PEI last year got an unprecedented... Oh, sorry. They want you to answer.
Yes. Absolutely yes.
Absolutely yes.
Absolutely
Perfect.
Yes.
Thank you, Minister McLean.
Yes. Very easy question to answer.
Perfect. Thank you.
again, back to the financial resources and stuff that we put in. Again, that's an indication. If it was going the other way, I would be concerned for sure. But
No,
it's
and
not.
we've heard from the government that money's not the issue, which is excellent.
Yep.
But it's just a matter of, the commitment that it's going to stay open and what are the tangible next steps to move forward. So, but from Health PEI, is it that same commitment that you can express that there's no further reduction in services and that it's an expansion and a growth?
It is absolutely an expansion and a growth.
Perfect. Thank you. Excellent. Thank you for that. We're going to move slightly out of the rotation. I am going to come back to there. Don't worry, we do have some more time. Mr. Martin, I think, is going to ask a question, correct, Bill?
It's not. It's working now. Hopefully it'll work. I spent a good part of the last 2 days listening to the 3.5-hour presentation of your health committee with Dr. Gardam. Didn't know much about him before. I know a little bit more about him now. And I'm glad you just mentioned that financial resources were not an issue. I'm a lifelong resident. I'm a former mayor. I'm a business owner. And I care about my family. And those people who know me, and I've got a few employees here tonight. Whoops, I didn't do that. Did you do that? Anyway, we'll know that it's all about people. In March of 2023, the province of Nova Scotia No, we're fine. The province of Nova Scotia announced on March the 20th, 2023, when Nova Scotia, $10,000 bonus for nurses and $5,000 for all others working in healthcare. PEI followed that up with $8 million, but it only gave it to nurses. In addition, only 4.3 of the $8 million was spent. When asked for his opinion, Dr. Garden at Health PEI stated very strongly to the Premier's office and anyone who would listen that everyone should be included because everyone is valuable. So I have a very simple question. Did you support that decision, and what impact do you think it had on morale?
Thank you, Bill.
Thank you, Bill. Thank you, Bill. I was elected in November 2021 and became finance minister late in that summer. Again, so I don't want to deflect your question, but I was not directly involved. I think we all have understood the damage that it caused. I think we need to continue to work to improve wages and so on and so forth. I think we've committed, and Corinne can maybe kind of confirm some of this about some, especially our high vacancy positions. And again, we responded to our RT issue as well. And again, I call it, we want to invest in our people. I would agree with that. So I understand. I think the Premier has always, it's been just an unfortunate situation. And again, it's been hard to deal with. I did a tour of the facilities. I probably had met with more than 200 healthcare workers, and the message was strongly sent.
Thank you, Minister. Are there any further comments from either Dr. McNally or Corinne?
No, I would just add that, as Minister mentioned, it's been stabilized right now at the RT level. That was part of the collective signing of the collective agreement, that there were certain positions that are low in numbers, that are incredibly technically and that technically trained, and that we have to right-size the wages for those 5 groups. And so it started with RTs, but it's going to continue with the other 5 that have been mentioned in that collective agreement. Understood. Thank you, Tracy.
Thank you. We've got a question in the back. Yes, ma'am.
Hi, I'm Vanda Darash, and I worked critical care for 30 years at Prince County Hospital. I want you to explain to this crowd here tonight, these Summerside residents and elsewhere who access Prince County Hospital, how we got here. Because you're saying it's a human resource issue? Well, where do those people go and why? Let's hear about the why. So are we being listened to when we talk about 14 full-time equivalent internal medicine at the QEH and 2 at Prince County? When those 2 internal medicine people left, what did they ask for? Help. And you say you have money. You didn't give them that help. I have sat on a ton of provincial committees, and I can tell you, it is very difficult to get Prince County Hospital's voice heard. So that's the reality. If we listen to all islanders, so when we go to, just as you said, that provincial system where we have that board, one island, one health, well, it's becoming one island, one hospital. I ask you, when you're talking about having these positions filled, how are you going to keep them? Are you going to have the 5 internal medicine doing 1 in 5 call? When we have a greater population, we have more individuals who have no family doctor, who are sicker and need to access critical care, intensive care. How are you going to keep them from being overworked like they were for years? RTs, how are you going to keep them on call 24/7? Are you going to have the same complement or at least equivalent to the percentage of beds as the QEH? That's my question.
Thank you, Vanda. There's a few questions in there, Vanda, and I think you pointed on a really good one, and I'm very curious to know as well. What did Health PEI know before we went into the system of losing the ICU? What did Health PEI or the Department of Health know and when? So I think from Vanda's question, was Health PEI aware that we were heading to this situation?
So I'm going to start by talking about how we're going to keep people, so what did we know and when? I think was the question.
Yeah.
Okay. So there are signals in our system that is showing that we are under pressure. There's no doubt about that. So as we have moved through the pandemic, as Dr. McNally mentioned, and the other shocks to our system, we are seeing the fatigue and the intention for people to leave our system. We have collective agreements and people have mobility across the system. So there are people who will choose to leave to go to other positions. What we have to do is create that pipeline so that people are coming into the system and that people have the mobility that they want.
Would you acknowledge, though, that Health PEI knew that there was an issue coming and for whatever reason nothing happened? Because we know that those ICU physicians that ultimately left and then services degraded, we understand that Health PEI was well aware of their issues and complaints months in advance, but there was no reaction or there was no... those issues, we understand that those issues weren't addressed and they weren't heard and they got fed up and they left. So what Vanda had mentioned, and that's kind of a key, I think it comes back to the accountability piece that we put together at the first place. To at least acknowledge that, yes, we were made aware, but unfortunately nothing happened.
So I want to talk about the physicians for a sec. I am going to answer the question. But you have to let me answer the question, and part of answering the question is saying one of the things that happened is retirement. We, when I came, had the oldest physicians in the country, and we're pretty darn close still. Also, call is hard, like we talked about earlier. Call is the rotten, horrible work of medicine. And there's lots of docs in this room who can tell you how hard call is on them and their families. And people did not want to continue to do call. But if we don't have people on call, we cannot run a hospital. Because a hospital doesn't shut down at supper time and open again in the morning. It's open all night. And that means there's doctors and nurses and staff. That is not true. What's not true? The call's hard? Well, I guess what I would say to you is that that's what they told me. So I'm not going to argue about it with an entire crowd. What I'm going to tell you is that we need people on call. There was interviews about this a year ago or more than a year ago where we talked about that. So I can't talk about the specific individual circumstances. That's not fair to them. I can't tell you what they told me because that's not fair to them. But I'm going to tell you again, medicine's hard. And somebody said, are we going to make them do call 1 in 5? Well, 1 in 5 would be a luxury for most of your physicians at Prince County Hospital right now. The groups are very small. They're doing a lot more call than that. There's people in this room, they're doing 1 in 2, they're doing 1 in 3. That means every second night, or every third night, or every fourth night. So 1 in 5 is onerous, and there are people, many of the docs, doing a lot more than that now. So do we need more physicians? 100%. And we need other healthcare providers to support them. So the physician assistants and the associate physician and the extenders and the locums. And right now, the funding is for 6, but there was the health intelligence report. I don't know if you guys saw that, the David Peachy report. It was in the news. He says we need a lot more than that. A lot more. Almost double is what we need in terms of our physicians on this island, according to his report.
Okay, thank you, Dr. McNally. I'm going to continue to move. I think we've got another question in the back, and I'll start to come back up this way.
Hi there, can you hear me?
Yeah.
Yes. Hi, I'm Shayna. I'm a nurse at... I work at the Prince County Hospital ICU, which is, I'm going to just continue to call it that. And I've been through the struggle of losing all of our physicians when they retired and the ones who left because they were getting what they needed. And but now I just kind of wanted to have a conversation about, we're talking a lot about recruitment and what you're doing for that, but how do we retain the ones that we have? Like, how are we going to keep Dr. Murphy around? You know, like, I just really don't understand the plan, I guess, for that. And also, you said we needed about 17 nurses to keep our unit, and right now we have what? Well, currently we have a 73 point something or other vacancy rate of nurses, which means the rest of us are doing far too much. So if we're talking about call and 1 in 5 and this and that, and the doctors have to be there, and, sometimes we call them in the middle of the night and sometimes we don't. And I'm not taking anything away from how difficult their life is, but we are drowning. And and you're talking a lot about getting nurses from other countries and this and that and the other thing, and how long that's going to take, though, is the question. On when they get here, they're going to not be able to practice as an RN right away, and what does that look like? We put them through school, they're a PCW first, or I'm not really sure how that looks, but right now we have a lot of travel nurses, and I'm not sure that the public knows how much our travel nurses are being paid and how much money and how much money is being allocated to that, like for their hourly wage and their travel being paid for and their accommodations, everything. It doesn't matter if you need a rental car, that's paid for. You can bring your dog, that's paid for. And I travel every single day. I'm not from Summerside, but I love it here. I love my hospital. I love my colleagues. I love my patients, and I don't want to leave.
Thank you. Thank you. So I'm gathering the question I think that's in there is what's the current plan for recruitment? Because what you're seeing right now is a potential further burnout rate.
Yeah.
Retention. Sorry.
How
retention,
are you going to
yes.
retain us?
Correct. So that's the question of the panel. What is the retention plan?
So with our nursing colleagues, and I do want to thank Shayna for bringing this up, we have signed a collective agreement, and in that agreement, we have committed to working with our unions around in a joint consultation group. That work, I believe there's been a couple of meetings that have happened, and part of that is looking at our wage rates with our nurses. We have our classification system for nursing started in 1998, and we know that care has changed since then. So we have had initial conversations with our unions and with the Public Service Commission about a path forward with that. So wages matter. I understand that 100%. In terms of the travel nurses, we absolutely need them right now. We're the last province in the country to actually start to use them. Travel nurses don't come with, they don't have pensions, they don't have sick time, they don't have vacation time. So they work and then they leave. And that's the reality of working as a travel nurse. So we understand that we have to pay more for that, and it is not our intention to continue with that. It is a temporary measure.
Thank you. All right, well, BP, yeah, the gentleman in the hat there.
We are here to discuss the RT crisis. What about the anesthesia physicians? I'm sorry. We are here to discuss the RT crisis. What about the anesthesia physicians? What about the specialists of medicine? At the time of virtual meetings, do we read in-person interviews in Singapore and Dubai? And also, too, is how can we believe you? Because the past governments said the same thing. We'll fix healthcare. We'll fix healthcare. And the current government now, healthcare has only gotten worse. And my wife was in the ICU, and I know darn well the staff at the PCH are amazing. And anything that, and thank you to every one of you. Anything she needs, they're there. So if they gave me their word, I'd believe them before I believe you. My question is, my biggest question is how are we going to believe the word you're saying? Because past is the past, and it hasn't gotten any better. It's gotten worse. And you talk about retention and bringing all these workers here, which is great, but how are you going to keep the workers that are here? The ones who love to stay here, love to raise their family, but they can't speak up for fear they're being reprimanded. And I work in healthcare, so I'm taking a lot of risk even speaking up. But we get reprimanded if we dare even speak to anyone. So what are you going to do to make us believe what you're saying is true?
So
thank you, sir. I'll put that to the panel.
Yeah. So I think the key to what you said is retaining and bringing help here. I think the fundamental thing that I'm hearing is that healthcare workers need help. They want to have their vacation. They want to be paid a fair wage, and they want to practice to their full scope and have time with their work-life balance. Those are the key things that I'm hearing all the time. So how we do that is by increasing our overall capacity and our overall staff. Because they aren't getting time off and they're not getting relief and they're feeling distressed when they go home, when they can't do their best. So that's part of the reason why people are leaving healthcare. And we need to ensure that when they do come to work, that they are able to do it and feel safe. And it makes me sad that you feel not safe speaking up as a healthcare worker. Anesthesia? We know that we have recruitment for anesthesiology.
Yeah, anesthesia is a huge problem. You're 100% right. We're short across the whole province for anesthesia. So there's a lot of stuff been done to try to do that. So actually the There's an anesthetist from PEI at a recruitment conference right now in Canada trying to recruit anesthetists as we speak. I spoke with him today before I came here. So what's been done in terms of anesthesia, we have family practice anesthetists, we have Royal College trained anesthetists. I think our anesthetists are underpaid on PEI. We're in negotiations with the Medical Society right now. That's been something that's been identified. We've worked with other hospitals in Canada to try to have projects, pilot projects, where they come support us with anesthetists from some of the larger hospitals. So there was a hospital in Toronto that was coming regularly to provide anesthesia care, and they lost 11 in a month, so they stopped coming at their hospital in Toronto. So anesthesia is a big problem. You're 100% right. And there's a lot of work being done by the recruitment and retention team to try to do that. The other thing that's been done is we need all the help we can get with recruitment. There's no question. So Health PI also hired a private recruitment firm in addition to the efforts that are being made by the recruitment and retention team, specifically to try to look at internal medicine, anesthesia, family medicine, and emerge. So those four being specifically targeted as well.
Anecdotally, I've heard that certain physicians and medical students have reached out to Health PEI and recruitment and have not had any response from anybody.
Derek?
Is there a plan in place to address that, or do you acknowledge that that's the case?
Derek, this has been bone and contention since I took on the role, that I've had people say, I heard that such and such didn't get back to such and such. I've had 16 specific instances where I tried to chase it down. I can assure you 15 out of the 16, we were having we were in contact with physician or healthcare provider. So the other one, I think it was a junk email perspective. I would say anybody in the crowd today, if you feel that has happened, please let me know. Please reach out to me with the name, the details, and I will get back to you. My own MLAs have done this for me a few times. I've given them the contact records and what they attended this event. We exchanged emails and a phone call on this. So I would always caution that this is the most competitive workforce in the world, and it would just simply not make sense for us to not call anybody back, and that does bother me, and you can tell by my tone. But I will commit to anybody in the crowd to, if you feel that we haven't connected with a healthcare provider, please let me know. And one more point before we leave is, I think it's important to note too about medical graduates or medical students. Because of privacy laws, we do not know who the 85 medical students are at Dalhousie University, for example. But there is a medical learners form. They can sign up. So if you have a son, a daughter, a niece, or anything, they can simply just search PEI Government Medical Learner, put their email in. We won't badger them, but we will let them know about recruiting events. We will invite them for site visits, so on and so forth. So that story of us not getting back to people, in my experience in 8 months, has been proven false. Thank you.
Okay, we got a question from the floor.
Yeah, that'd be me. I've done my absolute best since the day that I sent my letter of resignation. I've done my absolute best since the day that I sent my letter of resignation to the Premier to make no comment on any of this. And unfortunately, Mr. Minister, while I expect what you just said is what you've been told, it's not true. I received an email 3 days ago Sadly, I receive too many emails with respect to these things that cause us all way too much concern and too many sleepless nights. But I received an email 3 days ago from a medical student. I'm reluctant to say where because, unfortunately, I know the repercussions from speaking up from within Health PEI. So I'm going to try and make this in such a way that it's at least somewhat more difficult to identify the person. The question was, to a third-year medical student, have you been contacted by recruitment? So I'm going to quote, long story short, nope. It's actually been extremely frustrating for myself and my other 3 PEI classmates. PEI hosted a recruitment event here, and when I told them that I was a third-year student interested in family medicine back home on PEI, they were shocked, LOL. But I haven't heard from anyone since. I've actually tried to get in contact with Heather L'Esperance early in December to ask about funding for housing when we do our mandatory rotations on PEI. It's now mid-January and I've still not received a reply. Our Newfoundland and New Brunswick peers all get funding for housing for rotations, but not us. So it's definitely been a bit disheartening, but not surprising. As an aside, another 4th-year student, he graduates in August, who's from PEI, wants to be a family physician in Montague. He's had 1 contact from recruitment in the last 3 years to, quote, see if he's interested in PEI, end quote, but then he's never heard back from them again. So unfortunately, while I have no doubt what you are saying is true from your perspective, what you're being told is not necessarily true.
Thank you, Mr. Key. I'm not sure, the minister, if you want to respond to that or just take that in.
No,
or...
I appreciate your comments, Derek. Again, for me personally, I've heard these stories and I like the name, so I will, if you would like, I will look into it for sure. I'm not confused. I mean, I don't know why something like that would happen. In the first instance, about contacts and whether we have that person's information. But again, I've had this from my own MLA group who have given me names. We have a lot and I've committed to chasing them down. So I'd like to know where that break is in the system, in the communication side, and we need to meet expectations, I guess, of what they want. But again, it's been important to me, and I want to hear how the situation happened. We need to look at that, but I do find it
Thank you, Minister McLean. We'll certainly, there's a few more questions. We are running out of time here, so we'll just take a few more. I'm looking at my mic people. Okay. We got one in the back there.
Hi. Can you all hear me? Yes. Hi, I'm Karen. I am international med. This. No. There. Okay. I am from Mexico. For 5 years. I've been working at the PCH for 2 years as an LPN because I contacted Health PEI 5 years ago, asked them if I could work as a physician, and they said, no, you have to go through all these steps before you can work with us as a physician. And now I cannot work as an associate physician because I'm out of currency of practice, because I haven't been practicing for 5 years. And anyway, you don't have to feel bad for me, but oh, thank you. Yes, I just want to understand why you're recruiting people from Ireland, the UK, USA, when you have nurses, physicians, and so many healthcare professionals here in PEI that are willing to work, and they haven't been hired for whatever reason, and I don't know why you're recruiting over there when you could recruit here, and we have a housing crisis, and you want to bring more people in. I don't understand. But yes, I just want to understand why you didn't start with the recruitment here instead of going abroad, sending I don't know how many people, spending on flights, spending meals, spending on stay, spending all this money that we provide with our taxes. So yes, I don't understand, and I wish you could explain that to me.
Thank you. That's an excellent question. I'll put it to the panel.
So Karen, it's an awesome question. And Health PEI does not decide who's eligible to practice or get a license on PEI. Those are the regulatory bodies, the colleges. And so the short answer is the regulations and the regulators have to decide what the criteria are for somebody to get a license in order to practice in their discipline. So APs, or associate physicians, like you talked about, were just introduced in the legislation this year. And yeah, PEI is behind, and it was just introduced, as so were physician assistants. And that's awesome. And they said the currency of practice is 3 years in order to do that. So we have to follow what the regulatory bodies say. We can't hire someone to be a physician who doesn't meet those criteria. I know. I hear you. I hear you. And so, again, yep. Yeah, so the regulatory bodies put it in the legislation this year. They're looking at the criteria again now, and we talk to them all the time. And what I would say, Karen, is come talk to me after for a minute so we can talk about steps that we can take about your currency possibly, okay?
Thank you. Thank you. All right, we're going to do a couple more in the back, then we are going to move up this way because I know there's a couple questions I want to hear. So we'll do one or two more in the back, and then we've got to move up. Yeah, and this is a 15-minute warning. Mr. Burley, go ahead.
Hello. Yeah, so I'm Thomas Burley. I'm from around the Ellerslie area up west there. And being from up west, we're very familiar with the threat to our hospitals because it's the same thing in Western as well. We're used to the reduction of services. And one of the things that we find is when a hospital up west gets closed, well, it puts more strain on the PCH. It floods the emergency departments here because places like Alberton are closed. So one of the concerns my community has is what happens if you have a heart attack in an area like Tignish, and you need real, medical attention. At first, okay, Alberton, no, that's closed. PCH, well, the ICU is getting pulled there, possibly. We don't know, right? We can't trust what you guys are saying. We don't know what's happening. Like every government we've had, it just lies. It's been lies. So the big concern here is if somebody has a medical emergency in Tignish, do they have to go to Charlottetown? Like, we don't want to see that, right? So my question to you is this. You know, what are you going to do to make sure that all hospitals in PEI, you know, the Prince County Hospital, you know, QEH, but also like Western and Kings County as well. We need all the hospitals operational, all the emergency departments operational, and we need to support all the medical staff in these hospitals. So, like, if somebody in Tignish, what are they supposed to do? You know, like, we have no confidence in you guys. We really don't. It's frustrating.
Thanks, Thomas. I'm not sure if the panel has a brief response to that.
I would just add that I agree with you that every hospital bed is needed in the system, and we need to maintain that. The need for critical care transport is really important, and we have been working with our Island EMS partners to ensure that that's going to be available. So that, and I want to reiterate that the somebody with a heart attack would be coming to Prince County Hospital Emergency Department to be stabilized and then either admitted or transported out, either to the QEH or off island as needed.
Thank you, Corinne. Okay, one more question from the back. Yes, ma'am. Go ahead.
Hello, everyone. Hello. Hi, everyone. I'm Cheryl Keown. I'm Health Council President. And actually, when you're talking about recruitment and retention, we've been down this road, I think it was October 17th, 2022, that a bonus was given out to nurses and left all CUPE members out. We all matter. If you didn't have ward clerks, service workers, cooks, maintenance, plumbers in these facilities, they wouldn't be operating. I have been a Health PEI employee since 2005, and I love my job, and I love my facility. And with this recruitment and retention bonus, it has divided staff, and I mean divided. And echoes to Bill Martin and echoes to Derek Keys for speaking up, because we're now into 2024, and you have not answered our emails, our messages, our phone calls. We are support service workers, and we deserve that bonus also, and we all matter.
So a question to the panel, is there a commitment as well to look at retention for support workers?
Yeah, again, we've had this question already this evening, and I think, again, we need to work through it. Again, we value we value all our workers in the healthcare system. Again, the rationale was a retention incentive to try to try to keep our nursing staff in our system as long as we could. Again, other jurisdictions have done similar things and different things that we've done. So I appreciate the question for sure.
Thank you. I believe you got a question there, Darren. Do you want to go ahead? Oh, no. No, hold on now. Yeah. Okay, that is a fair question. So, Dr. McNally, is there any comment to that? We've obviously heard from one healthcare worker tonight already who's expressed concern about speaking out. There was the open letter from the physicians. Do you have any comment on that?
I applaud your physicians for speaking up and being passionate about what they're doing and where they're working. I am a physician. I work in this system too. My phone, my text messages, my emails, and my phone calls would say that there's a lot of people not afraid to speak up because I have a lot of communication on a day-to-day basis. It just shows their dedication and compassion that they spoke up. They care, and that's great. They work hard and they care.
So is there going to be any changes within Health PEI to address this situation that's been outlined by the physicians? And there's obviously some bureaucracy issues and efficiency issues. So is there commitment from Health PEI to make those changes immediately?
I actually, we've spent a lot of time here tonight talking about the health human resource issue. There are efficiency issues, and we do have teams that do work to streamline things. We have had a number of projects that have been underway to highlight where we can gain those efficiencies, and they have been published. So we agree with what you're saying, and we're going to continue to do that as well. But that isn't going to...
Okay. Okay, thank you. And again, we want to try and keep it.
Yeah.
Is there any response to that very quickly?
From the physician perspective, I don't know what your 5-step process is that you're referring to. I don't know what Dr. Trevor Jane said about a 5-step process on January 31st, but...
Okay.
Yeah.
Thank you, ma'am. Thank you. That's an excellent example. Again, we have to watch the time here.
Yeah.
You recognize that there's challenges there. Corinne, you have a comment.
I think it's important to recognize that medicine and our operations are more intertwined and working together than they ever have. And that's really important to address the systemic changes that we have in our system. So the names that you've commented on there, we have meetings almost daily in terms of ensuring that those barriers are removed, that patient flow. And I did reach out to Dr. Jane today to ask him his question, to understand some of the ideas that he had indicated in the standing committee meeting. So we do meet on a daily basis across our system. It's intertwined more than it ever has, and we need that system to flow so that patients can be seen in the right place in the right time.
Thank you. Darren, you want to go ahead?
Thank you. Darren McKinnon, I'm Deputy Mayor at Town of O'Leary. It'll be 1 year in 2 days that we joined a group of all the towns in the western part of Prince Edward Island to discuss healthcare in our region. And I know we're here tonight to speak about Prince County, and that's where it'll be focused on. A couple of those major points that were put in that letter from the 3 towns in West Prince to this date have never been addressed. And one of them I'm going to speak of because it was brought up by Mr. Burley in Tyne Valley, and that's should a system get adjusted to be experienced what's being proposed temporarily, when you have a catchment area that's an hour, 20 minutes away from Summerside, with a density of population of approximately 15,000 people, with the median age 60 years old, probably, that might be little generous. How is it possible that we're going to be able to sustain critical care transport from that area to Charlottetown based on the current state of our emergency medical transport system, and have it done quickly as we may need it? I know there's discussion of the plan that is in discussion, but I hope it's furthered in discussion by the time that it's needed, because if not, there was ugly words thrown out earlier in the evening like mortality. That's going to happen. And I personally know that because 3 years ago my son was in a severe accident and near died. And I can tell you one thing, if he didn't have a lot of wonderful hands on him that night, including the Prince County Hospital, it'd be a different conversation tonight, because both his legs were near amputated in an accident. And I can tell you that that service, we have to ensure that there's some type of intermediary service to make sure that residents are transported, or it's going to be a very critical situation. Thank you.
Thank you, Darren. Quickly to the panel, if there's any comment on that.
Yeah, just a quick comment on that. It's great. Again, we've invested in, we call them transport units. We've added 2 transport units. We do have an ambulance or 2 on order. Again, I'm not the operational person for this, but I do. And we also have 9 paramedics in the advanced care paramedic program currently that will graduate in the spring. So again, and then we have another class, obviously, of paramedics coming out of Holland College, again, with our tuition program. So we are increasing, access to ambulance services. We have to do that. We understand that. So we are taking some steps. So thank you for your question.
Thank you.
Can I just add?
Sure.
Does that match the timeline of what we're discussing tonight?
I guess my answer would be, again, back to the training of those people. That's a requirement. Ambulance delivery times are long. My understanding, it takes almost a year. Again, back to supply chain issues and related to COVID. So again, we've actioned on that. You're right. We'd want it faster than normal. So great question. I appreciate it.
It didn't answer my question. I
don't understand.
I guess my question is, are we going to be prepared in all facets of response should we experience what we're discussing tonight?
We have talked with Island EMS about this, and they have also put in community paramedics as community transport, community ambulances that don't require transport. They've done that to take the pressure off of the existing ambulances so that they can remain in communities in West Prince and Kings, so that they are coming in, coming out.
But that's being done now, correct?
It is being done now.
And wait times are excessive, sometimes in excess of 2 to 3 hours. I would suggest that probably it's going to be a bad situation, but I'm not educated fully on the topic, so I'll leave that to you guys to look at and discuss, but I assume it's going to be a major concern. And the other thing that I would suggest, it'd be to the minister, if we could please, with all due respect. A major component of discussion tonight is communication. Again, as deputy mayor and as part of a town council and as a group of 3 different towns, do not have a response back from the department on those multitude of items that are critical to the folks that we represent is really not very acceptable. So I hope that will improve going forward.
Thank you, Darren. We won't have a comment or follow-up on that, but I certainly appreciate and reiterate that, yes, indeed, communication has to improve. We've heard that. We got one final question. Al, you go ahead.
Good evening. I'm Alan McGinnis from Tignish. I'm the mayor of Tignish. I've been listening with great concern this evening, and we talked about a lot of different things. I think what I think is the main problem And I have to just go offline for a second. When I was a young fella, I fished all my life, okay? So when I was a young fella and I jumped in a boat with my father, well, first thing I wanted to do was head for the wheel. He kicked me in the arse and told me to get in the stern and learn what to do before I got at the wheel. So anyway, I somewhat grew up, I guess. I'm mayor of Tignish. I was on council for quite a few years before I became mayor, and I didn't like the situation that was taking place, because most of the time, the mayor made the decisions during the month and didn't give his councillors the opportunity to do their work. Right now, I'm the mayor of Tignish with a beautiful council ahead of me, and they're doing their job quite efficiently. And if you come to Tignish, we have a lot of newcomers up there, and we have a lot of new businesses, and we have a lot of new infrastructure. So anyway, what I'm trying to say is, you've been Minister of for 8 months, and previous to that, Ernie Hudson, I think, was Minister of Health for a few months. I'm not trying to criticize you, but what I'm saying is, before you get to the wheel and make decisions for the healthcare of Prince Edward Island, I think that Health PEI should be able to do their job, because as far as I can, they're supposed to be professionals in that field. But when you and the Premier interfere with decisions and make the decisions for them, then you're not doing your due diligence as far as taking care of your constituents on Prince Edward Island. So I suggest that maybe you should do maybe what I do as a simple person from Tignish, is stand back, let your professionals do the work, and learn from them, and not try and do the job that you're not qualified to do.
Thank you, Al. Thank you. I'm not sure if there's any comment or anything from the panel in that regard, but I'll give you just a few minutes to wrap up, because we've got to tone it down here. So yeah.
Yeah, again, thank you, everybody. Again, I hope some of the messages about some of the change, things that we've tried to accomplish over the last year or so will have the intended results that we want. I know so many of these issues are human resource issues. Even though your police force has put out some recruiting incentives in order to staff that. So all of these challenges are human resource. We need people in the right places to provide service. It is a challenge, there is no doubt. And I appreciate everybody coming here tonight. And again, I think we're very accessible. And again, reach out to either your local MLA or me directly, and we'll move from there. Thank you very much.
Thank you, Minister. We do have a few final remarks from the Mayor before we wrap up. Again, I want to thank everybody for coming. It's been a real pleasure. And the Mayor's going to say a few words. Thank you.
First of all, thank you, Derek, for doing such a fantastic job moderating this evening. Thank you, Minister, for coming, CEO, CMO. I hope you have had the opportunity to listen carefully, because clearly there is a lot of information that people in this room know, and that hopefully you guys will help learn. I said at the beginning, I was looking to listen for a few commitments. I didn't hear those commitments tonight. I didn't hear anyone say we will commit to a plan to stabilize critical care at the PCH now, or to develop and execute an open plan with PCH staff and input, or to go all in on retention, or to stand up and say we will be accountable. I did hear from the interim CEO that you will grow the PCH, and with that, I have something to take away that is hopeful and optimistic. So thank you for that commitment. Timelines matter. We can say we want to do things or we desire to do things, but timelines matter. They are important to accountability and to getting things done. Our doctors have asked for this to be done in 6 months, and we haven't heard the response. So I think next time, if we have to have a third town hall on this issue, we will schedule it in the rink, and we will get everybody here who couldn't come. Thank you. Drive safe. Have a good evening.